Great, welcome back to House Healthcare. It is Thursday afternoon, February 1st, and we are turning to a committee bill, an act, so it doesn't have a number yet, an act relating to peer support provider and recovery support specialist certification. And so we have a couple of folks with us who work in this field or connected to this field, and we've asked for their thoughts on the bill. So we're going to first turn to Gary. I'm not even going to pronounce. I'm not going to try your name. If you can introduce yourself for the record.
Sure. My name is Gary DeCarlos. I'm the Executive Director of Recovery Partners of Vermont.
Great. And so just a reminder, our committee does not normally have jurisdiction over recovery. So if you can just provide a little background as part of your testimony on who you're representing, just to set the stage for us, that would be great. But Gary, I'm going to turn it back to you for your testimony.
Okay, thank you. And I'll be glad to do that during my comments here. Before I start my formal remarks, I did want to say that the Department of Corrections currently has a proposal in front of the legislature to fund recovery coaches in the correctional system, both while they're incarcerated and then following them after incarceration. I have I think I have a handout that I submitted earlier that details that in a little bit more formal way.
Great, thank you.
Again, thank you for allowing us time today to talk about this particular bill. Recovery coaching within Vermont's 12 recovery centers has been a growing and powerful tool in working with guests. When I say guests, I'm talking about people who could be 5 minutes into recovery and people who could be 35 years into recovery. Your 12 recovery centers, one, are staffed by all people themselves in recovery from alcohol or substance use addiction. And at least 50% of the folks that walk through our doors are in the first 6 months of their recovery. So they're really in a very fragile early stage in recovery. And that's exactly what we want to see. It's those people coming through our doors so we can provide them with support and services and welcome them into the world of recovery in a very big way. We have watched this recovery coach service grow over the past 14 years. In the beginning, we had recovery coach academies where people in recovery for at least a year who wanted to become a coach would go to train. Subject matters like boundaries, ethical guidelines, self-care, active listening, and developing a recovery plan of action would be discussed. Upon returning to their local recovery center, newly minted recovery coaches would receive supervision in-house and furthered learnings from staff on community and in-house resources and continued learnings around ethical and boundary issues. As the years have passed, peer recovery coach supervision has become more formalized in the recovery centers. And you're going to hear from two amazing supervisors of recovery coaches, as well as they do direct recovery coaching themselves. And now to be a certified recovery coach, one needs to continue to learn, and a certain amount of CEUs are required every 2 years to keep their certification. This all has helped professionalize the role of the recovery coach. In my former role as the executive director of the Turning Point Center of Chittenden County, I actually had a 3-year period of recovery required before one could become a certified recovery coach. For me, this group of coaches were the elite group of coaches in our center. We had the luxury of having a companion program of peer support workers who needed only 1 year of recovery to provide that less intense support. I wanted them to have a solid foundation of recovery before they provided support to others. So here we are with Bill 24-0641, which would license peer recovery coaches. I think this is a terrific move forward. The state is looking to be able to bill Medicaid for this service in the near future, and this bill would solidify peer recovery coaching as a legitimate professional service that deserves reimbursement from insurance programs. One area that needs close attention is background checks. I noticed on page 8, many of our recovery coaches have had a justice-involved history. When decisions are made around what constitutes an offense that could prohibit someone from becoming a coach, I hope we are involved in that decision and sitting at the table. In closing, I again want to also mention that I attached the FY25 priorities for the Recovery Partners of Vermont for your information. You will note one of the priorities is peer recovery coaching in the correctional system for inmates pre and post incarceration. The pilot at the Marble Valley Correctional Center, in partnership with our Turning Point Center of Rutland, has been wildly successful. We would like to take this statewide. The Department of Corrections fully supports this request, obviously. And we know too that when upon leaving corrections, the chances of a fatal overdose is about 120 times more likely than someone outside of the correctional system. It's a critical service that we think we can make a big difference from. Thank you for your time, and glad to answer any questions if you have.
Great. Thank you, Gary. Does anyone have any questions? It was very clear and succinct support for the bill, so we appreciate that. All right, we are going to turn to Melinda White, who's recovery coach for Turning Point of Franklin County. Hi, Melinda.
Hello, thank you so much. I appreciate the opportunity to speak with you all today. My name is Melinda White. I am a Turning Point of Franklin County recovery coach in the emergency department supervisor, so our local hospital, Northwestern Medical Center. And I'm also employed as a medication-assisted treatment blueprint lead in our community. So I appreciate the opportunity to highlight the bill and the value that it'll bring to the recovery coaching and peer recovery support services profession. They play a large part in individuals who are living in or seeking recovery from the effects of substance use disorder. And as Gary mentioned, many people coming in the doors are new, and also there are people that may have many years in recovery, and yet we encourage people that when they find something that works to continue doing it. So this provides that opportunity. And since I started working in the field approximately 12 years ago, the role and supervision of a recovery coach has definitely become more professionalized. As a person myself in long-term recovery, who had spent approximately almost 2 years in residential treatment programs, different treatment programs. That was after having been arrested for 4 DUIs, having overdoses, missing persons report filed, and failed suicide attempts. I mentioned that especially the DUIs because Gary just touched on the background investigation and what that would look like. So just wanted to highlight that many people I work with also have a criminal history and also have the ability to be very effective once they get in recovery and start working in the field. And I was gifted an opportunity to find recovery through a combination of different services, clinical, medical, but especially the peer support. As I mentioned, multiple stays in different treatment centers. When I finally added in the peer recovery support services, that's when I was able to find and maintain consistent recovery. I learned how other people had pursued a lifestyle of recovery and were able to heal. And most importantly, I was able to find what I defined the 3 Ps needed for fulfillment in life, which is purpose, passion, and pleasure. So not only being in recovery, but working in the field has allowed me to have those 3 Ps. And I also like to mention, I feel like I found that subtle shift of trying to be the best in the world to try to be the best for the world, and having that purpose of being able to make, even if it's a little change in somebody's life. And ultimately there's that butterfly effect of when a person heals, their family and friends heal, the community becomes more healed. So there's lots of ripples that come from a person entering recovery. In my current role as a recovery coach supervisor in the emergency department, I have the gift of working closely with our local medical and clinical professions. And historically, I've worked in a hospital as well as in a clinical setting for our local designated agency. And we have relied upon, when I say we, when I was working in the clinical and medical, we relied heavily on the local recovery coaches as part of a patient's treatment program. And I work closely with primary care physicians in my blueprint mat lead position. And again, recovery coaches and peer recovery support services are what they rely heavily on for people who are new in recovery, or even people that might be in recovery and doing well as far as use go, but just struggling because things still happen in life. Just because we stop using doesn't mean that we don't lose jobs or relationships and have health issues. So it's an opportunity to be wrapped around by a supportive community of people that are in recovery too. I'm a board member of the Vermont Alliance for Recovery Residences, which is the organization that certifies the recovery residences. And I regularly witness, by having one down the road from our recovery center, people that go to live there after doing a residential program, deciding to become recovery coaches, and in turn, coaching people who are going through that system. So it's one of those occupations that when a person wants to be a recovery coach, a certified recovery coach, they have the ability to give back by drawing on their own experiences, and also bringing hope to people because they can say, yeah, I've been there. With my position in the ED, I can tell people I've been in that bed before. And there's a way out. You can get through this. You're going to be okay. When Recovery Coach Certification Committee was formed, I was asked to be on that and have been since its creation. And we spend countless hours thoughtfully coming up with trainings and education that would be appropriate for coaches to earn CEUs, to continue their education, to make sure that we're providing them with ethics and boundaries and motivational interviewing. So we put a lot of thought behind what it would be approved for CEUs and what wouldn't be, because we want our coaches to be equipped to give the best care and to be informed. And with this bill, it would enable the licensure of the peer recovery coaches, and that would move us forward with the ability to bill Medicaid for this legitimate service. And it's something that I know for myself in my short time working in the field, and I've talked with others in various positions, that it has been something I have truly hoped and dreamed that this day would come. So seeing the bill is very exciting. Recovery coaches do use evidence-based practices, and they complement the work of the medical and clinical communities, as well as other community service providers. We work closely in our community with law enforcement, Department of Corrections, with the housing providers, with Agency of Human Services. So it's just really part of like strengthening that continuum of care that's going to result in healthier communities. So I'm excited to see that this bill is in front of your eyes. I strongly support it. And to close, I'll just echo what Gary had said with the 1.5 million. I know this is not a budget meeting. I just wanted to mention where it ties in, that having the ability to continue supporting people who are in the most vulnerable and dangerous position of potential fatal overdoses. What a blessing it would be if we're able to provide more support to those individuals who are exiting incarceration, and as well as provide the support while they're incarcerated. So they're not only anticipating a day to come out, but they're getting some healing and some coping skills so they can come out and be productive members of the community. Coaches work very closely with the restorative justice centers. I physically am on site at the local restorative justice center on a regular basis and do meetings with them weekly. So the partnerships that we have with the medical, the clinical, and the wraparound service providers is critical for the people that are being supported. And I'm just really grateful that you gave me an opportunity to come and talk to you about it today. So thank you.
Great. Thank you, Melinda, for as part of your testimony, sharing your personal story. It means a lot that you shared that with us. I just want to say Representative Whitman came in. He's with our House Human Services Committee. He's usually the one that works with recovery. So Dane, if you have any questions, just jump in. Does anyone have any questions for Melinda?
I guess, what's the process when a patient goes to a hospital or whatever? Who determines they need peer support? How quickly will that be administered? And what's the process?
I don't know. Did you hear that question? I don't know if either of you could answer that. Melinda,
Yeah.
I'll start with you.
Sure, yeah. So in our local hospital, the recovery coaches page, we all have pagers. So the coach on call is Paige, and the decision can be made by whether it's a physician, whether it's a nurse, anybody who's on that person's care team. If they identify that there could be a benefit for that person to connect with a recovery coach, then they'll page us. I'm fairly close, so typically they're within a half hour tops. And it's an opportunity that we offer the person 10 days of follow-up, and we're providing them anything from making a call right then and there to a residential treatment program. If they're saying that's what they want, they may need to go to detox, scheduling them with a recovery coach appointment, when it works for them. So there's also a lot of wraparound services. I've had an individual that was fleeing domestic violence and didn't have a phone. So I left the hospital, drove to Voices Against Violence, picked up a phone, drove back to the hospital, got that person a phone. So then when we're calling treatment and they need to be reachable for the calls back with bed dates, the person has communication. So our coaches our key job is motivational interviewing, listening intently, and then resource and referral. So making sure that people have the resources they need to continue in their recovery. But again, sorry to go on a tangent. So it's the medical providers or the medical team. I've been paged by nurses, by medical staff, providers. As soon as they page us, we're there.
That help, Ellen?
Thank you.
Okay, great. Great, I think there are no more questions, so Daisy?
Hi, Melinda. I just wanted to say thank you so much for sharing all that you do. I think you forgot one thing, and that is the advocacy that you do. I've actually met you a couple times at conferences, at the recovery conferences, and just wanted to say thank you for sharing your story and continuing to work so hard. We really appreciate your work.
I appreciate your comments. Thank you so much. I think the best way for us to reduce negative bias and stigma is to be open and speak about our experiences. And I've learned the more that I share those experiences, they've lost their power. So it's something that the past is a springboard forward. It's not a hammock. And I'm grateful for the people that helped me.
Great, thank you, Melinda. Dane?
Thank you.
You know what, Dane, we have empties. Why don't you just sit next to Melanie? Bobby's not.
Feel happy with Dane.
Yeah, I know.
Hell yeah. Introduction. Yeah.
Hi, everybody. I guess for the record, Dane Whitman. I just wanted to ask, as far as the point that was brought up earlier, as far as the background checks and things like that, I also noticed that in the bill as written, and if Gary or anybody envisions like an ideal kind of mechanism to make sure that people are included within that rulemaking process, if there's any like proposals for how to build in to make sure that it fits what you're hoping for.
Yes, well, and I've spoken to Emily Truder from the Department of Health about this as well a little bit, but what I asked for and what she said that they would ensure happen is that we just sit at the table on all the meetings around rulemaking so that as these issues come up about, background checks and things like that, that we could talk about the staff that work in recovery centers and their justice background and advocate on their behalf to be able to be licensed and be a certified recovery coach, as Melinda shared with you just a little bit ago. So it's really just being, there's an old saying, nothing about us without us. So that's what we're talking about, basically.
Yeah. And Wilder White's been heavily involved in this. So Wilder, do you want to say something?
Yeah, Wilder White, they're the consultant for the Pathways Vermont. They work with developers. So in terms of certainly the mental health care support provider, what we've worked out with the Department of Mental Health and the Office of Professional Relations is that criminal history is not per se disqualifying to become certified. As you know, part of the bill, there's a board of advisors, 2 certified peer support providers and 2 recovery care specialists. And so if a person has a criminal history, the director, we envision the director consulting with those advisors to determine whether there's a nexus between the criminal conviction and the responsibilities and scope of practice of the peer provider. And so the example that Lauren Lehman gives, she's the attorney for the Office of Professional Regulation, is, we wouldn't license or regulate, we wouldn't certify or license an accountant who had embezzled from their client. However, we would, license and certify that accountant to do something else, like become a peer support provider. And so there's not only in rulemaking, there'll be an opportunity for input, but I think where it's more important is that those board of advisors will be vested with the authority to advise the director about whether there really is a nexus between the criminal conviction and the role.
So I'm hearing it's almost on like a case by case basis.
It is a case by case basis, and there's also the opportunity to appeal an adverse decision with full due process protections.
Thank you.
Great. All right, Melinda, thank you. Roberta, we'll turn to you. Oh, I'm sorry, Leslie, did you have a question?
Well, I'm sorry if I missed this, but the Board of Advisors, is that in the bill? Or is that
Yes.
typical?
It's in the
I'm-
bill, it's not typical,
It's not
just-
typical, so there's
Wait,
no.
wait,
Yeah.
wait.
H2.
There could, so OPR has boards of advisors and then boards who do all the work, right?
Okay.
The way that this profession is being regulated is through a board of advisors, and it is in the bill.
So it's not doing something new, it's sort of applying it in this case.
Yes.
Thank you.
Great. Roberta, we'll turn to you.
Okay, thank you so much. And I just want to make sure you can hear me.
Yes, we can. Thank you.
Okay. First of all, to echo the comments of Gary and Melinda, I understand we're not in a budget meeting, but I would echo the need for the request we have to provide those necessary services for folks who are, as Melinda said, the most vulnerable and most at risk for overdose. And I also want to thank you for the opportunity to speak about the importance of recovery coaching in general in the overall well-being of individuals and families working through the challenges of substance use disorder and addictive behaviors. I am the supervisor of coaching at the Addison County Turning Point. And we all have a few hats, but I also do training there and do outreach. And my look at recovery is from the whole system, because I grew up in the shadow of addiction. I'm from a small blue collar town in the Midwest outside of Chicago. And my father, like his father before him, and most of his coworkers, cousins, friends, drank daily. It was part of life. And for my father, however, the drinking took his life. And long before he died during his second stint of alcohol detox treatment, when I was a teenager, he became unrecognizable to his friends and families and an outcast in the community. And it wasn't something until I didn't understand until many years after his death, I came to learn about the traumatic events that interrupted his life, a life full of promise and hope, resulting in a life of pain, loss, self-medicating, and ultimately addiction. I never got to meet the man. Once brilliant, fun-loving, kind-hearted man that would become my father. And I found out about him when I was taking a phone call from somebody who went to high school with him for the reunion and described this man that I didn't get to meet at all. And neither did some of my siblings. I have 5 siblings. Addiction and its underlying causes were not really fully understood and may not be fully understood now, and nor was the impact of addiction on family members and the greater community. I was at once drawn to, with regards to recovery coaching, to the collaborative nature and the strength-based nature. And it uses, as Melinda mentioned, the evidence-based approach of motivational interviewing. And it's defined, it's a particular way of talking with people about change and growth to strengthen their own motivation and commitment. And at our center in Addison County, recovery coaches are offered weekly supervision, and we have a learning community format where the coaches can check in, they maintain and build coaching skills, and they get support with challenging cases so we can work through them. And for the last 3 years, I've coached individuals and family members whose lives have been totally derailed by addiction and have witnessed the positive impact recovery coaching has made in helping people make significant changes in their lives. Recovery coaching can be as one-on-one interactions, group facilitation. I go to Valley Vista, which is a treatment center in Virgins, twice a week, and do group facilitation. And then community outreach. We go to the schools, shelters, treatment centers, and community centers. In Middlebury, there's a place called Gather that we get to talk to a lot of folks. Recovery coaches also receive additional training to work as recovery coaches in the emergency department, which Melinda spoke so lovely about. And the work, we work with Porter and work you know, side by side with some of the staff where they call us in, and it could be if somebody is coming in clearly intoxicated and, you know, a very obvious need for supports, or they would benefit in some way. For example, if they understand. So it's a really wonderful service that the hospital's very happy to have kind of partnership with us. And there are also other training to work in correctional facilities across the state. And now here we are again, as Gary said, with Bill 240641, seeking to license peer recovery coaches which would legitimize already the valuable work that's being done throughout the state. And it would create, you know, the stability in the workforce, you know, workforce funding through Medicaid reimbursement, and also have the impact of having standards, that solidarity of training and supervision standards. And this seems like a very natural evolution of the profession, and it would place coaches, recovery coaches, on the continuation of care teams alongside medical and mental health professionals. So it would be all part of the team for that wellness. It would also reduce the stigma that's often associated with recovery services and normalize the use of getting recovery supports as part of overall health wellness. As in closing, I just want to say thank you for your commitment to improving delivery of services and promoting the well-being of individuals, families, and communities.
Thank you very much. Again, thank you for sharing your story as well. Does anyone have any questions for Roberta? Great, thank you all. We appreciate your time. We have two more people to talk with. I think at least one is here in the room. Chris, you want to come up?
All right.
Welcome.
Hi. It's my first time in the state building, so I'm getting my bearings.
Congratulations. Love it. Good. Hopefully you're enjoying your time. So if you can state your name and who you're with, and then
Absolutely.
do your testimony.
Absolutely. So I'm Chris Nile. I'm here kind of wearing a number of hats, but I've been working in the mental health peer support kind of side of this bill. So I work with Pathways Vermont. I've been doing peer support now for the last 3.5 years, and have worked at our Soteria House in Burlington. I'm now the team lead for the community center, and the statewide Vermont peer support line. I also hold the role as co-chair for Alyssum, which is our peer respite down in Rochester as well. So I am really excited to be seeing this finally moving forward and or seeming like it might be moving forward. I had the chance to attend many of the stakeholder meetings with Will the White, and lots of colleagues I know and folks from DMH and peer recovery movements. There was many meetings very thoroughly going through this, what would this look like for peer recovery, and having a lot of stakeholders at the table to make sure that we were getting something that was going to meet the needs of those of us doing this peer support work. So I can speak to you that I support this certification. I think it's past time for us to have some structure for peer support workers to be able to do this work and get the respect that it really deserves. And I support the bill as it is written currently. I did hear there was a question previously about age of peer support staff. So I wanted to just name, I have hired folks who are over the age of 70. I have hired folks that are under 21 in our community center space to provide peer support. They have been incredible at the jobs that they do, right? Like the work that we're doing in mental health peer support is focused on connection. It's focused on being able to relate to someone and being able to really bring your humanity into the work, and connect with people on a peer-to-peer level, and bring your lived experiences and bring what you've gone through to be able to find those connections, and give people that sense of not being alone through what they're going through. And so that is what we do. And I've seen staff do incredible jobs with this, regardless of the age they are. We all have the capacity to connect with people and to really be of support to one another. So that is the work that we get to do in our spaces. I will just add to, have been said to be a little bit gung-ho with the peer support. I've really dove in hard with it, and I want to just name my past. I was working running an after-school program for 5 years, and right before the pandemic, had my first experience with a mental health crisis. And I had something that most people don't have. I had a father that was trained in peer support and practiced that with me. So I didn't have to experience the traditional medical model that would have told me I'm ill, would have told me what it is that I'm going to be needing. And I wouldn't be running the programs I'm doing now if I hadn't had that support. So